Teachers Union SADTU says it's confident of a seamless rollout of COVID-19 vaccines to educators around South Africa. This as the Department of Health is expected to begin inoculation of teachers within the coming week. Administrative and support staff will also receive their shots irrespective of their age. So about 300,000 Johnson & Johnson vaccines will be set aside for the education sector, with the first doses arriving today. The Health Department is aiming to inoculate 500,000 educators within the next 10 days, with schools expected to host vaccination sites. Teachers will not be required to schedule appointments and simply need their medical aid information, as well as their cell phones. SADTU's General Secretary, Mugwena Maluleke, joins us now for a sense of how things will unfold. Great to chat to you, sir. Thanks for making time for us on the AM report. Let's begin perhaps by understanding how much you know about how this will actually take place, logistically speaking. 300,000 vaccines arriving today. Do we know where they're going and who's up first?
Well, good morning, and good morning to your viewers at home. Let me thank you for the opportunity indeed, and for really sharing the information with the public, and in particular the frontline workers being the teachers. The vaccines that will be arriving today will first have to be checked by the University of Free State, where there is a national laboratory, and once that has happened, then they will then be dispatched to various provinces. What provinces have done, have been able to upload information from the MES report or database into the EVDS database for the Department of Health, and therefore they can then be able to say for certainty that in particular districts so many educators and administrative staffs are there, and therefore because the centers for vaccination will be schools, it is easier for the Department of Health to be able to dispatch the personnel that have been procured or who have been contracted to be able to do that. So administratively and logistically, work has been done over the past month in May and April when we started these particular talks.
Yeah, there are obviously a whole lot more schools than there are vaccination sites, and it'd be difficult to ensure that they're all working at full capacity. Whose responsibility is it to ensure that a school is ready, as far as you know, of course? Is this more the ambit of the education department or something that the health department said they'll take care of?
Is the Department of Education and working together with the Department of Health, because what the Department of Health wants gives those particular specifications, and then the district offices under the MEC and the head of department have been working tirelessly for that, in making sure that those particular sites that have been designated as schools for the inoculations are ready for the Department of Health. So they've been working together, so they've been a cooperation, and we really want to appreciate that cooperation that we have seen, so that then within these 10 days and even during the holidays, the teachers will continue to be vaccinated. Ours is to encourage them to really take up this particular vaccine, because it can save lives and it can protect them and their communities.
Yeah, it's 300,000 vaccines as a start, as already mentioned. We obviously need a whole lot more, and that's going to open up the conversation around who must be vaccinated first. I remember at the onset of the pandemic, there were real concerns around teachers with comorbidities being obviously more at higher risk, for lack of a better term. Is there a plan to ensure that those are the people that are targeted initially? Or again, I certainly get a sense it's a first come, first serve type arrangement as long as you're a teacher.
Yeah, well, because initially it was going to be 40 and above, including those with comorbidities. This has changed apparently, and we will hear more when the Minister of Education will be addressing the nation tomorrow. What we understand it is that because there will be other vaccines for Johnson & Johnson that are arriving next week, about 1.2 million, that will also be set aside, making sure that the administrative staff as well as all the teachers are vaccinated. So therefore, meaning that the issue of comorbidities is also covered. The issue of 60 years has already been addressed, because those who are 60 years and above have already registered and they were already been taken care of. So the those that are remaining, there will be no discrimination in terms of their vaccination. So 300,000 is arriving now. However, within 2 weeks' time, Aspen has indicated that about 2 million will be arriving, and therefore part of that will then be used for the vaccination of the teaching fraternity.
Of course, this doesn't mean that outbreaks won't take place. We've always known that being vaccinated doesn't mean that you won't test positive for COVID-19. Just yesterday, we heard from the Gauteng Education Department that 20-odd schools had been closed in some respects because of the virus. Are you happy with how current outbreaks are being treated as a teacher union?
And I must indicate that we are concerned about how these outbreaks are being treated, and therefore we are having a meeting tomorrow morning with the Minister of Education to express our concern, but also to understand how best are we responding to these rising numbers in our schools, and how best are the standard operating procedures being used, because some parents are receiving mixed information from the schools in terms of whether there's a breach in terms of the protocols and so forth. And they're concerned about their children, and we're concerned about our teachers. So when the schools closes down, parents have got to be well informed about what's happening so that they are then able to manage how their children are going to be taken care at home. Because you know that the school is a microcosm of the society, but also is playing a very important role in really driving the economy to work. Because if parents do not have information and they just been told by an SMS or overnight that the school is closing down, they don't know how to deal with their children who are sometimes, of course, they are minors and they don't have anyone to help them. So we need to improve the communication, the transparency around the issues. So we're engaging the department to deal with that. We are really concerned about the health and the safety of all the workers, in particular the teachers and our learners in our schools.
Yeah, so it's issues around clarifying how we can prioritize those with comorbidities. It's matters of transparency in the likelihood of an outbreak at a school. What else are you hoping the Basic Education Minister will address when she speaks tomorrow?
We believe that she will also address the issue of when we reopen on the 26th, will the schools be ready for, in particular, the primary schools, because the directions were indicating that all the primary school learners will then be reporting. However, this was not without any condition. At the time, the science was saying that learners are not contracting this particular virus in the number that they are contracting, and therefore that would have to change the basics in terms of how the direction have got to be implemented. And the other issues would be the issue of infrastructure. Will the schools be able to comply with level 3, as the president has pronounced that we need social distancing as a fundamental tool for us to be able to defeat this particular disease. Therefore, we want to believe that the minister will also have to clarify the issue of the 26th of July when we reopen, because we don't believe schools will be able to accommodate all the learners. We really appreciate the fact that our learners are really facing a generational catastrophe because they've missed so much, and we want them to be able to recover. However, it cannot be at the expense of their lives.
Speaking about recovery, in 30 seconds, there had been some kind of recovery plan outlined by the Basic Education Department about making up for lost time. So much more time has been lost since that plan was outlined. How confident are you that we'll ever be able to make up the time lost to the curriculum specifically because of this rotational teaching arrangement, as well as, times when schools quite literally had to be closed down?
I want to believe that the only way that we can be able to do that is when we can put the transmission under control. We need to contain it. If we cannot contain it, there's no way we can be able to say any plan is going to work, because the pandemic itself is so unpredictable, and therefore any recovery plan is going to be affected by that unpredictability of this particular virus. So let's work together. Let's make sure that we bring the numbers down. Then we can be able to recover.
Mugwena Maluleke, thanks very much indeed for always speaking to us. Really appreciate your time. He's the General Secretary of Teachers Union SADTU.